Good morning, welcome back. Well, concussion talk is everywhere in sports right now, especially around football. And joining us this morning from Gunderson Health System to discuss that, athletic trainer Ryan Henke. Ryan, thanks for joining us this morning.
Thanks.
Ryan, obviously, like we said, concussions are the big talk when it comes to the medical profession around sports, especially football. What are you guys seeing locally? Is there any trends you're seeing this year?
Well, with the football season being completed now, we kind of take a look back at the data that we've had in our different high schools around the area, kind of see how many concussion injuries we've seen and kind of reassess our return to activity protocols and just get ready for the winter and spring seasons.
Okay, so that's something that's going on right now. You don't really have necessarily any numbers yet. That's something you're going to be looking at this winter?
Yep, we'll be collecting some data and kind of looking at it, and then just kind of starting the discussion of amongst the athletic trainers that work with Gunderson and the physicians and physical therapists here, and we'll kind of see if there's some trends compared to previous years, as well as looking into is there any trends that go into the winter seasons.
Sure.
That we can hopefully help with the any spring injuries that we have.
Yeah, it can be a big concern for parents, and especially in practices that's sort of supposed to be maybe a little bit less contact, but people are still going full throttle with that. Have you found ways to sort of make injuries a little bit less prevalent during practices?
Yeah, with a lot of information that's out there and classes that coaches now have to take at the beginning of the season, I think their knowledge has definitely increased and improved their efficiency in practices, and definitely has limited the amount of tackling during practice, but also increased the amount of teaching of proper tackling techniques, starting at the very young youth programs and then all the way through the high schools.
Yeah, now obviously football is just one sport where concussions can be prevalent in the winter season. You have hockey, you have basketball, things like that. And in the spring even, you can get concussions. But based on your previous numbers, things you've looked at in the past, are concussions as prevalent throughout those seasons as well as in the fall with football?
Football usually is the one that's most talked about, but there are student athletes who do sustain concussions in other sports as well. You have to look at the amount of student athletes that are involved in football compared to some other sports. As like a basketball team, you only have 12 to 15 guys per team, whereas football, it can be up to 90 players.
Oh, yeah,
so there's a lot more instances that may occur either during practices or games.
Sure.
And Ryan, one last question. If your child does get a concussion, should we immediately take them to the hospital? What are the protocols after that?
They do need to be seen by a physician. They can be monitored symptom-wise if they have a variety of symptoms, or if they have any issues with vision, balance, personality changes, nausea, repeated vomiting. We strongly recommend that they be seen by a physician.
All right, always good to know. Ryan, thanks so much for joining us once again this morning.